We have an iguana here now, and you notice that I'm wearing some pretty heavy-duty looking gloves. That is because iguanas are tree climbers, they're tree dwellers, and they have extremely sharp claws. And so I'm holding them with kind of your basic lizard hold here, where I've got kind of a thumb tucked behind this leg over here, the 2 fingers on that side. He's got a little bit longer neck there, so I can't quite reach my fingers up in this hold to keep him from turning his head, but his head's not flexible enough to turn all the way around backwards and bite or grab from this position. Now here's a good view here of see how those claws go up onto my arm, and that's why you don't want to use short gloves with this this kind of an animal. Now where it gets really dicey with an iguana is when you have to turn them around and check their mouth, which is what we're going to do when we want to check their health. You look to say, make sure it looks like pink and healthy and everything like that. And getting them to open their mouth is fairly easy. Often you can take your hand and kind of tuck the tail underneath there. Make sure you're wearing thick clothes underneath though for the tail. Sometimes you can gently just touch underneath the mouth and get them to open their mouth. Now he might not cooperate there. There we go, there's a little bit of movement. And all I did, I got the tail tucked underneath there. I put my hand over the top here, and of course now you see he's very much open in his mouth. One thing to be aware of when they start to struggle like this, just stay calm yourself, right? Often they're going to defecate and urinate onto the exam table, but all you want to do is just kind of maintain that hold and just let them calm down. You don't want to try and do anything too rash or too quickly. You just want to make sure that you give them an opportunity to calm down. Now, if it seems like that maybe they're taking a long time, one thing you can sometimes try is to cover their eyes. And you can sometimes use a towel to do that. With a lizard like this, as strong as he is there, you probably wouldn't want to try and do it yourself though. You probably want to have someone else step in and kind of gently cover their eyes. And see he's moving a little bit there still. I can feel him slowly kind of lose steam. We have a towel here. So what you want to do is you come from, I'm going to turn away from him. And you want to do it from behind him. There he goes, as you see, he calmed down there. Because if you do it from the front, then of course you're approaching him from the mouth there. By coming from the back there, you keep your hands out of the way. And you can see that now he's going to see if he can shake that off there. But you never know what's going to work with each animal. Every single animal has their own personality. And some of them, if they haven't been handled a lot, then they're going to be maybe much more aggressive, and they're going to be much more stressed and nervous. If they're handled all the time, you'll typically know that because when you see an iguana that's handled all the time, often the owner will take them out and just set them on their shoulder, on their hand. So yeah, ask a lot of questions when someone brings in an iguana to know just how handleable they're going to be.
Okay, great. Thank you for showing us this.
There are various diseases that you might see when taking care of large lizards at your clinic. These can include things like kidney disease. It's often due to chronic dehydration and excessive dietary protein. This is a common problem in iguanas. Retained eggs are common in any large lizard species, and these can be pre- or post-ovulatory eggs. Nutritional secondary hyperparathyroidism, also called metabolic bone disease, is quite commonly seen, especially in iguanas. Obesity and fatty liver disease are common in monitor lizards. Bacterial infections are common in all of these lizards, and it's usually due to inappropriate husbandry conditions. And finally, trauma is seen pretty often.
Well, the smaller lizards have smaller teeth and smaller claws, so you still have some of the same things to worry about, but typically you're not going to need as heavy-duty equipment. Most of the time you can get away with just gloving up, which you're always going to want to do when you're handling any reptile without knowing their full history, because they often carry salmonella. Now you can see I don't have the lizard out yet. I've got him in his carrier, and you'll often see owners bring animals in crates. Sometimes I may bring the whole enclosure, which is great because you can get an idea of what their setup looks like. But many times it's going to be something like a Rubbermaid container with some holes drilled inside. Now this is nice because it can actually look down here and see where he is. Because the idea is when I open this, I don't want him facing me, because then of course he's coming towards me. I don't have much control. So I want to make sure he's turned away from me there. And you want to just kind of lift up the edge there and make sure he can't go out that side, and reach in and very gently, slow but sure. You want to do it with confidence and do it quickly, but you don't want to like just grab him and pull him out. You want to give him a second to realize what's going on here. I'm going to just gently bring him out here. Now I'm still going to use kind of the same lizard hold. The difference is he's got much shorter legs, so he's kind of resting his legs on my hand right there, but I still have my hand over here, kind of tucking behind his leg, and I've kind of tucking that leg there. Got my fingers behind his beard there, and you can see that little beard there, those little puffy jowls with all those spikes there. Now with these smaller lizards, you don't want to put much pressure on them. You have to be very aware of putting pressure on them, especially because a lot of people don't realize the balance that these lizards need with light and vitamins. So often you can get a lizard like this that comes in that has some bone density problems, and so they have very maybe soft bones that you could injure very easily. And same thing with the tail. I am supporting the tail and the legs back here just to kind of control, but I don't want to actually hold on to his tail there. If he whips that tail around, it's not going to do any damage to me anyway. Now when I turn him here, right, you can see claws. Claws on lizards are one things that you often have to sometimes trim for an owner. And of course, we always look inside the mouth and the eyes in order to see that. And with a nice small lizard like this, as long as you're supporting the bottom part of his body here, you can often kind of bring your hand down like that and use the table for support. And sometimes you can actually tickle them just underneath the chin to get them to open their mouth, instead of having to use some type of spatula to kind of get into the corner of their mouth. But of course, he doesn't seem interested in that. The other thing you can sometimes do with these lizards is to rub the top of their head. Some of them, if they're aggressive, they'll open their mouth. But as you can see, this guy seems to think that that's a great little massage for a bearded dragon right there. And so the smaller lizards, same basic techniques, but you just want to be gentle so that you don't harm them. They can be quite fragile, especially when they come in when they're not healthy.
It's important for the doctor and the assistants to feel confident in their ability to handle reptiles. The patient and the owner can both sense if we don't feel confident in our abilities, and that can make both of them more difficult to work with. The patient's body, for example, should always be supported when you're restraining it. No animals like to be dangled in the air. The handlers also need to not appear afraid of the patient. You can't be holding a snake and holding it away from your body and acting squeamish while you're restraining it. Also, it's important to become comfortable enough with these patients that you know when to restrain the patient quite firmly, and when maybe a little bit less is more. So sometimes these patients can be like cats. Sometimes if you have an aggressive cat, excessively restraining it will make it strike out more. And these patients are often more comfortable if they are being restrained minimally to safely achieve whatever our goal is.
So David, I understand that we have a leopard gecko now, which they're a lot more fragile than the other lizards we've talked about.
Yes, so far the lizards we've talked about have thicker scales, and so they're more armor-like. The leopard gecko has much softer, more delicate, flexible scales, so we have to be much more gentle in the way we handle them. So we still have to make sure we glove up and that we're protecting ourselves. And when you go to get these guys out, you're going to want to take it nice and easy, kind of open up and see where they are, and gently put your hand over the top of them. Now you don't have as much to worry about with these guys biting, but they are pretty quick. So you want to reach in there and get a hold of them. Now they're going to be a little squirmy, so you kind of can cover their whole body a little bit and kind of use your hands, get them in position here to kind of gently hold that leg. And see, I'm just going to put my hand over the top of him a little bit to help him relax and calm down. This makes him feel more secure. Nothing can sneak up on him. Now, you don't necessarily have to use like a lizard hold with these guys as long as you find a place where they're comfortable. Many times pet owners hold them in their hands and they'll kind of do a little gerbil thing, one hand in front of the other, let them walk along. So they kind of feel comfortable like this, but you do still want to control them. So in this case, I'm kind of supporting his whole bottom part of his body. I have my thumb on top, not pressing too tightly, but if he does start to move forward, I can kind of use my thumb and my fingers together to keep him from moving forward. I'm never going to hold the tail. Now I can support it. You can see he's got a pretty good sized tail there because of course these guys do and can lose their tail, especially when they're stressed or frightened. And although it does grow back, you don't want to find yourself in the position of having to carry the gecko out separate from the tail to give back to the owner there. So everything about these guys is just going to be nice and gentle and easy and supporting them. And then that way you can turn them and get a good look. And you can see actually he's got a couple of little retained scales on his toes right there at the end. And that is one of the things that we often see reptiles for is retained scales, and his are pretty loose. Those are probably going to come off. That wouldn't be any concern at all. But you know, you might recommend that the owner actually do a little soaking or make sure that they have enough water to get in and out of so that they can do that themselves. And I was hoping maybe he'd do it when he's out here. You don't see it very often. One really cool thing, I think, besides the handling thing, is to watch these guys clean their eyeballs off. They actually will stick their tongue out and lick their eyes, and it's a pretty cool thing to watch. But that is the leopard gecko, and the bearded dragon and the leopard gecko, probably the two most common lizards as pets, and the ones that you're most likely to see in your practice. So
Great.
It's important to be aware of the complications that can arise when we're handling reptiles and amphibians. So some examples would be that many lizards can drop their tail if they're being inappropriately restrained. So when we're restraining lizards, we always try to hold their pelvis and the base of their tail rather than holding the body or the tip of the tail, which would be more likely to cause them to drop it. And as you can imagine, the owner is not going to be happy if they bring their pet to you and it drops its tail while it's at your clinic.
And we're meeting a red tegu. This is a large lizard from Argentina, South America. And the tegus are similar in size to monitor lizards like savanna monitors and iguanas. And so handling your bigger lizards can have its challenges because of their strength. There's a couple of things you have to pay attention to when you're handling a lizard this size, and that would be the tail, the claws, and of course the teeth. This is an omnivorous lizard, so he does have very sharp canine teeth. Now, when I'm holding him, you kind of see how my fingers are kind of like wrapped around his legs here, and I've got these gloves on. Well, the number one reason you're going to want to wear gloves when you're handling any reptile is because of the possibility of salmonella transmission. You really are not going to know the detail of how the animal's being housed, the conditions, and so just be safe and glove up. Now, when I'm holding him, I call it my lizard hold, and I use this for a lot of different lizards. I've got my thumb tucked behind his leg on this side, and then I take two fingers on the other leg and I tuck it there, and I see my hand supporting his chest and his thorax. I also take my fingers, and he's got these fatty jowls right here, and you can feel the bones underneath his cheeks there, that I stick my fingers right behind there. That just keeps him from turning the head around and grabbing me or my hand. Now you notice that I'm holding his tail. This is not something you would want to do with every lizard. You have to really know what species you're dealing with. Tegus do not drop their tails, and so you can hold onto it. They store fat back here. It's got very strong muscles. And the reason I hold him like this is because I'm going to stretch his tail out here. You can see how long that is. One of his main defense mechanisms is to swing that tail like a baseball player swinging a baseball bat. And if he catches you the wrong way, it's really going to hurt. Now, you might bring a lizard like in this for a couple different reasons. One would be nail trims, and he's actually due, it looks like, for a little nail trim here. And so there's a couple different ways you can hold him. You can hold him like this when you're doing a nail trim, or if you need to have a little bit more control, what you can do is you can take and tuck that tail underneath your arm like that. That just allows you to control the tail. Then you can use your other hand to assist in maybe turning the leg away from the head like that, or maybe lifting one of these back legs out to help expose it, because you're going to need an extra set of hands. And as a matter of fact, if you have an even larger iguana, there's some that reach 7 feet long, or tegus can reach 5.5 feet long. You might even need a second person just to help restrain the animal. And so the red tegu, a very powerful lizard, one to use a lot of caution with. And even though you're wearing gloves, after you're done with the visit, I would highly recommend washing your hands all the time and use some type of alcohol-based sanitizer, because the salmonella is not something that you want to get exposed to. And with reptiles, it's definitely a possibility.
When working with large lizards, there are some safety considerations we have to keep in mind. For example, the large lizards can have sharp toenails that can scratch. And one way to help handle this is to do a nail trim, just with the lizard sitting on the exam table and not overly restraining it prior to the exam, so that can protect you from bad scratches. But additionally, wearing long sleeves and even just exam gloves can help protect you to a certain extent. from scratches. But there are some situations where you might need more than just a nail trim before handling these patients. So the large lizards can produce a really strong crushing or tearing bite, such as monitor lizards. So sometimes we'll use leather, like welding gloves, when we're initially catching them and restraining them. And you can use those just to protect your hands while you're initially gaining control of the lizard. Additionally, you want to keep in mind that they do have pretty powerful tails. So when we're restraining them, we'll often tuck the tail under our arm just to keep it from whipping us in the head while we're working on them.